What's the Spritam?
Spritam is specifically designed to treat a variety of seizures, including partial onset, myoclonic, and primary generalized tonic-clonic seizures. Unlike other treatments, Spritam is 3D printed using Apria's zip dose technology. Using powdered inkjet process licensed from Scorp, now a part of 3D Systems, Apria is able to 3D print batches of the formula in such a way as to yield an instantly dissoluble tablet. With just a small amount of water, Spritam can be taken by patients that might otherwise have difficulty swallowing a pill, such as some elderly patients. These tablets are designed to deliver large doses of the medication at once.
What's indications and usages?
Spritam is indicated for the treatment of partial onset seizures in patients 4 years of age and older weighing more than 20 kilograms. Spritam is indicated for adjunctive therapy for the treatment of myoclonic seizures in patients 12 years of age and older with juvenile myoclonic epilepsy. Primary generalized tonic-clonic seizures in patients 6 years of age and older with idiopathic generalized epilepsy.
What's dosage and administration?
First, we will talk about important administration instructions. Spritam is intended to disintegrate in the mouth when taken with a sip of liquid. As a primary method of administration, place tablet on the tongue with a dry hand, follow with a sip of liquid, and swallow only after the tablet disintegrates. Do not swallow tablets intact. Partial tablets should not be administered. Spritam disintegrates in a mean time of 11 seconds, ranging from 2 to 27 seconds, in the mouth when taken with a sip of liquid. Alternately, add whole Spritam tablets to a small volume of liquid in a cup, 1 tablespoon or enough to cover the medicine. Allow the tablets to disperse prior to consuming the entire contents immediately. After administration of the suspension, resuspend any residue by adding an additional small volume of liquid and swallow the full amount. No attempt should be made to administer partial quantities of the dispersed tablets. Administer Spritam orally, with or without food. The Spritam dosing regimen depends on the indication, age group, and renal function. Patients should be instructed not to push the tablet through the foil. The foil should be peeled from the blister by bending up and lifting the peel tab around the blister seal. Alternately, add whole Spritam tablet to a small volume of liquid in a cup, 1 tablespoon or enough to cover the medicine. Allow the tablet to disperse prior to consuming entire contents immediately. At cases of partial onset seizures, the recommended dosing for monotherapy and adjunctive therapy is the same, as outlined below. Adult and pediatric patients 4 years and older weighing over 40 kilograms. Initiate Spritam with a daily dose of 1000 milligrams, given as twice daily dosing, 500 milligrams twice daily. The daily dose may be increased every 2 weeks by increments of 1000 milligrams, 500 milligrams twice daily, to a maximum recommended daily dose of 3000 milligrams, 1500 milligrams twice daily. There is no evidence that doses greater than 3000 milligrams/day for additional benefit. Pediatric patients 4 years and older weighing 20 kilograms to 40 kilograms, initiate Spritam with a daily dose of 500 milligrams. Given as twice daily dosing, 250 milligrams twice daily. Increase the daily dose every 2 weeks by increments of 500 milligrams, 250 milligrams twice daily, to a maximum recommended daily dose of 1500 milligrams, 750 milligrams twice daily. At cases of myoclonic seizures in patients 12 years of age and older with juvenile myoclonic epilepsy, initiate Spritam with a dose of 1000 milligrams/day. Given as twice daily dosing, 500 milligrams twice daily. Increase the dosage by 1000 milligrams/day, 500 milligrams twice daily, every 2 weeks to the recommended daily dose of 3000 milligrams, 1500 milligrams twice daily. The effectiveness of doses lower than 3000 milligrams/day has not been studied. At cases of primary generalized tonic-clonic seizures in patients 6 years of age and older, adult and pediatric patients 6 years and older weighing over 40 kilograms, initiate Spritam with a daily dose of 1000 milligrams, given as twice daily dosing, 500 milligrams twice daily. Increase the dosage by 1000 milligrams/day, 500 milligrams twice daily, every 2 weeks to the recommended daily dose of 3000 milligrams, 1500 milligrams twice daily. The effectiveness of doses lower than 3000 milligrams/day has not been adequately studied. Pediatric patients 6 years and older weighing 20 kilograms to 40 kilograms. Initiate Spritam with a daily dose of 500 milligrams, given as twice daily dosing, 250 milligrams twice daily. Increase the daily dose every 2 weeks by increments of 500 milligrams, 250 milligrams twice daily, to a maximum recommended daily dose of 1500 milligrams, 750 milligrams twice daily. Spritam dosing must be individualized according to the patient's renal function status.
What's about discontinuation of Spritam?
Avoid abrupt withdrawal of Spritam in order to reduce the risk of increased seizure frequency and status epilepticus.
What's about dosage forms and strengths tablet?
For oral suspension, 250 milligrams, round, white to off-white, spearmint flavored, marked with, on one side 500 milligrams, round, white to off-white, spearmint flavored, marked with, on one side 750 milligrams, round, white to off-white, spearmint flavored, marked with, on one side 1000 milligrams, round, white to off-white, spearmint flavored, marked with, on one side.
What's about contraindications of Spritam?
Spritam is contraindicated in patients with a hypersensitivity to levetiracetam. Reactions have included anaphylaxis and angioedema.
What's about warnings and precautions?
Behavioral abnormalities in clinical studies. 13% of adult levetiracetam-treated patients and 38% of pediatric levetiracetam-treated patients 4 to 16 years of age, compared to 6% and 19% of adult and pediatric placebo-treated patients, respectively, experienced non-psychotic behavioral symptoms reported as aggression, agitation, anger, anxiety, apathy, depersonalization, depression, emotional lability, hostility, hyperkinesias, irritability, nervousness, neurosis, and personality disorder. Psychotic symptoms in clinical studies: 1% of levetiracetam-treated adult patients, 2% of levetiracetam-treated pediatric patients 4 to 16 years of age, and 17% of levetiracetam-treated pediatric patients 1 month to less than 4 years of age experienced psychotic symptoms, compared to 0.2%, 2%, and 5% in the corresponding age groups treated with placebo. In the controlled study that assessed the neurocognitive and behavioral effects of levetiracetam in pediatric patients 4 to 16 years of age, 1.6% of levetiracetam-treated patients experienced paranoia, compared to 0% of placebo-treated patients. In the same study, 3.1% of levetiracetam-treated patients experienced confusional state, compared to 0% of placebo-treated patients. In clinical studies, 0.3% levetiracetam-treated adult patients were hospitalized and their treatment was discontinued due to psychosis. Both events, reported as psychosis, developed within the first week of treatment and resolved within 1 to 2 weeks following treatment discontinuation. There was no difference between drug and placebo-treated patients in the incidence of the pediatric patients who discontinued treatment due to psychotic and non-psychotic adverse reactions. Suicidal behavior and ideation anti-epileptic drugs, EDS, including Spritam, increase the risk of suicidal thoughts or behavior in patients taking these drugs for any indication. Patients treated with any ED for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. The increased risk of suicidal thoughts or behavior with EDS was observed as early as 1 week after starting drug treatment with EDS and persisted for the duration of treatment assessed. Because most trials included in the analysis did not extend beyond 24 weeks, the risk of suicidal thoughts or behavior beyond 24 weeks could not be assessed. The relative risk for suicidal thoughts or behavior was higher in clinical trials for epilepsy than in clinical trials for psychiatric or other conditions, but the absolute risk differences were similar for the epilepsy and psychiatric indications. Monitor for somnolence and fatigue, and advise patients not to drive or operate machinery until they have gained experience on Spritam. Somnolence and asthenia occurred most frequently within the first 4 weeks of treatment. In general, the incidences of somnolence and fatigue in the pediatric partial onset seizure studies, and in pediatric and adult myoclonic and primary generalized tonic-clonic studies were comparable to those of the adult partial onset seizure studies. Anaphylaxis and angioedema. Spritam can cause anaphylaxis or angioedema after the first dose, or at any time during treatment. Signs and symptoms in cases reported in the post-marketing setting with levetiracetam have included hypotension, hives, rash, respiratory distress, and swelling of the face, lip, mouth, eye, tongue, throat, and feet. In some reported cases, reactions were life-threatening and required emergency treatment. If a patient develops signs or symptoms of anaphylaxis or angioedema, Spritam should be discontinued and the patient should seek immediate medical attention. Spritam should be discontinued permanently if a clear alternative etiology for the reaction cannot be established. Serious dermatological reactions, including Stevens-Johnson syndrome (SJS) and toxic epidermal necrolysis (10), have been reported in both pediatric and adult patients treated with levetiracetam. The median time of onset is reported to be 14 to 17 days, but cases have been reported at least 4 months after initiation of treatment. Recurrence of the serious skin reactions following recount with levetiracetam has also been reported. Spritam should be discontinued at the first sign of a rash, unless the rash is clearly not drug-related. If signs or symptoms suggest SJS/10, use of this drug should not be resumed and alternative therapy should be considered. Coordination difficulties, monitor for ataxia, abnormal gait, and incoordination. Advise patients to not drive or operate machinery until they have gained experience on Spritam. Withdrawal seizures. As with most antiepileptic drugs, Spritam should generally be withdrawn gradually because of the risk of increased seizure frequency and status epilepticus. If withdrawal is needed because of a serious adverse reaction, rapid discontinuation can be considered. Hematologic abnormalities. Spritam can cause hematologic abnormalities. Hematologic abnormalities occurred in clinical trials with levetiracetam and included decreases in white blood cell (WBC), neutrophil, and red blood cell (RBC) counts, decreases in hemoglobin and hematocrit, and increases in eosinophil counts. Cases of agranulocytosis, pancytopenia, and thrombocytopenia have been reported in the post-marketing setting. A complete blood count is recommended in patients experiencing significant weakness, pyrexia, recurrent infections, or coagulation disorders. Increase in blood pressure in a randomized, placebo-controlled study in patients 1 month to less than 4 years of age. A significantly higher risk of increased diastolic blood pressure was observed in levetiracetam-treated patients, 17%, compared to the placebo-treated patients, 2%. Seizure control during pregnancy. Physiological changes may gradually decrease plasma levels of levetiracetam throughout pregnancy. This decrease is more pronounced during the 3rd trimester. It is recommended that patients be monitored carefully during pregnancy. Close monitoring should continue through the postpartum period, especially if the dose was changed during pregnancy.
What's about adverse reactions?
Most common adverse reactions, incidence greater than or equal to 5% more than placebo, include adults, somnolence, asthenia, infection, and dizziness. Pediatrics, fatigue, aggression, nasal congestion, decreased appetite, and irritability.
I need to ask about giving medication during pregnancy.
Pregnancy. Prolonged experience with levetiracetam in pregnant women has not identified a drug-associated risk of major birth defects or miscarriage, based on published literature, which includes data from pregnancy registries and reflects experience over 2 decades.
I need to ask about giving medication during lactation.
Lactation. Levetiracetam is excreted in human milk. There are no data on the effects of levetiracetam on the breastfed infant, or the effects on milk production. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need for Spritam and any potential adverse effects on the breastfed infant from Spritam or from the underlying maternal condition.
I need to ask about giving medication for pediatric.
Pediatric use. Spritam is not recommended for pediatric patients that weigh 20 kilograms or less. The following sections describe age-appropriate indications. Partial onset seizures. The safety and effectiveness of Spritam have been established for the treatment of partial onset seizures in pediatric patients 4 years of age and older. Use is based on controlled studies in adult patients and efficacy data in 198 pediatric patients 4 to 16 years of age treated with levetiracetam with partial onset seizures. Safety and effectiveness for the treatment of partial onset seizures in pediatric patients below the age of 4 years have not been established. Myoclonic seizures. The safety and effectiveness of Spritam have been established as adjunctive treatment of myoclonic seizures in pediatric patients 12 years of age and older with juvenile myoclonic epilepsy. Primary generalized tonic-clonic seizures. The safety and effectiveness of Spritam have been established as adjunctive therapy in the treatment of primary generalized tonic-clonic seizures in pediatric patients 6 years of age and older with idiopathic generalized epilepsy.
I need to ask about giving medication for geriatric
use. There were 347 subjects in clinical studies of levetiracetam that were 65 and over. No overall differences in safety were observed between these subjects and younger subjects. What's about overdose? Signs, symptoms and laboratory findings of acute overdosage in humans. The highest known dose of levetiracetam received in the clinical development program was 6,000 mg/day. Other than drowsiness, there were no adverse reactions in the few known cases of overdose in clinical trials. Cases of somnolence, agitation, aggression, depressed level of consciousness, respiratory depression and coma were observed with levetiracetam overdoses and post-marketing use. Management of overdose. There is no specific antidote for overdose with Spritam. If indicated, elimination of unabsorbed drug should be attempted by emesis or gastric lavage. Usual precautions should be observed to maintain airway. General supportive care of the patient is indicated, including monitoring of vital signs and observation of the patient's clinical status. A certified poison control center should be contacted for up-to-date information on the management of overdose with Spritam. Hemodialysis. Standard hemodialysis procedures result in significant clearance of levetiracetam, approximately 50% in 4 hours, and should be considered in cases of overdose. Although hemodialysis has not been performed in the few known cases of overdose, it may be indicated by the patient's clinical state or in patients with significant renal impairment.
What's about Spritam and carcinogenesis, mutagenesis, impairment of fertility?
Carcinogenesis. Rats were dosed with levetiracetam in the diet for 104 weeks at doses of 50, 300 and 1800 mg/kg/day. Plasma exposure at the highest dose was approximately 6 times that in humans at the maximum recommended daily human dose (MRHD) of 3,000 mg. There was no evidence of carcinogenesis. As for the mutagenesis, levetiracetam was negative in vitro (AIMS) chromosomal aberration in mammalian cells and in vivo mouse micronucleus assays. As for the impairment of fertility, no adverse effects on male or female fertility or reproductive performance were observed in rats at oral doses up to 1800 mg/kg/day, which were associated with plasma exposures up to approximately 6 times that in humans at the MRHD.